Yes, sir, ladies and gentlemen. Her name is Dr. Melissa Clarke, physician, host of Excuse Me, Doctor with Dr. Mel, streaming Mondays, 9 p.m. on YouTube and Facebook. And, of course, she's the leading expert on just about everything. She's so smart. How you doing, Dr. Clarke?
I am doing great, Russ. How are you today?
Just fabulous. Well, October is Breast Cancer Awareness Month. What do women need to know?
Well, it's important to start mammograms at age 45. That's what the American Cancer Society recommends. And they even say some women should consider starting at age 40. Now, who are those women? Women with a history of a family history of breast cancer, and Black women. Black women should consider getting screened earlier because we get breast cancer at earlier ages and die at rates higher than any other U.S. racial or ethnic group. So those are some important things to know. And I'd also add that my roommate for medical school, Dr. Carmen Parrott, who was Black, she died at age 38 from breast cancer. So in honor of her, I'm asking all my sisters out there to adopt breast self-care habits. Up your fruits and veggies, avoid processed foods, limit your alcohol intake, and get daily exercise. And, of course, get your yearly mammogram.
Are you familiar with this BRCA test that women are taking to determine if they're predisposed to possibly getting breast cancer?
Absolutely. It's important if you have a family history of breast cancer that, and there are other cancers too that occur in a cluster, that if you have a family history of those cancers, talk with your doctor about getting screened with this genetic test because you might be at higher risk for you yourself going on to develop breast cancer later. And that's the purpose of a BRCA test, to see are you potentially at risk because of your family history.
Athletic wear and cancer risk. Explain that.
Yeah, so it turns out that there's certain sports bras and athletic shirts that were found to have high levels of this chemical called BPA, which we may have heard about from plastics, but it's toxic to our health, and it can be absorbed through our skin and end up in our bloodstream. And when it's there, it can block our hormones from working and result in everything from weight gain to cancer. There are about 11 brands that are involved. Some very well known. I'm going to talk about it more on my show tonight. So you tune in if you want to hear all 11 brands.
Wow.
But they're well-known ones. Yeah.
Can you tip us off on maybe a couple right now? Well-known brands?
Sure.
That people need to be aware of?
Nike and Reebok.
Wow.
Are two of them, yeah.
Does it say on the label that it contains this stuff?
No, that was done by research by an organization called the Center for Environmental Health, which has sent them notices that they need to clean up their act, so to speak, and have a plan to do that within the next 60 days.
Let's talk about life-saving benefits of walking. A lot of people are like, I got to jog, I got to go real hard, I got to sweat, and so on and so forth. But walking is very beneficial, right?
It is, amazingly so. So the average person gains about 1 to 2 pounds every year from young adulthood through middle age. And walking is one way to prevent that. If you walk 4 to 5 miles a day, so 8 to 10,000 steps a day, you're less likely to become overweight and obese and get a lot of the chronic diseases that go along with that. And you don't have to get out and power walk. You can just do activities like around the house and keep track of your steps, like housework, washing the car, walking the dog. All those things count in that total amount of steps.
That's very interesting. All right, tonight on your show, you say you're going to be talking about Breast Cancer Awareness Month. What else are you guys going to be discussing?
We're talking about that. We're going to talk about the athletic wear, but our main topic is spare the rod and spoil the child. That's what, Black people believe. But tonight I'm going to have an expert, Dr. Stacy Patton from Morgan State University. She's going to talk about whether spanking harms children's mental health or not. So we're going to take audience questions and comments. So tune in.
All right.
9 o'clock.
Dr. Melissa Clarke, I really appreciate that, and we'll talk to you next Monday.
All right. Y'all have a great week.